Okay, well, we're going to get right into our presentations. Our first presentation is Dr. Renee Gindi. She received her PhD in epidemiology from the Johns Hopkins School of Public Health. Renee is the chief of the Population Health Reporting and Dissemination Branch in the National Center for Health Statistics Division of Analysis and Epidemiology. That's a mouthful. All right, let's get our presentation up.
While we're getting that pulled up, I just want to express my appreciation for the invitation to join you here today. It is my pleasure to be here, and I'm going to be talking a little bit about, sorry if you can't see me from over there. I'm going to be talking a little bit about life expectancy changes among men and women, and giving you a look behind the numbers. Very often, probably you've picked up reports and you're getting these health terms or statistics, and you might have wanted to know a little bit more about them. So we'll be going through a little bit of the nitty-gritty on those today, and then I'll also be giving you some of the recent changes in statistics. So before I get started, I do want to emphasize that while I am from the Centers for Disease Control and Prevention, I am also from the National Center for Health Statistics. If you're not familiar with our work, we are one of the 13 federal statistical agencies, which means that our job is to provide all of you with authoritative and official health statistics so that you can make the choices and decisions about health policies and programs. Our agency does not advocate for any of the policies and programs in particular. I leave that to all of you in the room and, of course, my esteemed panelists today. So today I'll be talking about changes in life expectancy, death rates, changes in death rates that have contributed to those changes in life expectancy, and leaving you with a little bit of information about the leading causes of death. Most of the information that I'll be talking about today comes from a report that's actually in your folders right now. It is Health United States, and that is a congressionally mandated report on the trends in the health in the nation, and it's been published by NCHS almost continuously since 1975. Now, I'll be focusing today on statistics on health status and determinants, but we're mandated to cover many other areas. So if you're looking through that report and want to know more about trends in, let's say, healthcare utilization, we have information in there, healthcare resources, and healthcare expenditures and payers. I definitely encourage you to go to our website. That report is just a small fraction of the material that we have available. So we have plenty more online. You don't need to be able to see the details on this graph. The main reason that I have it up here is for three main points. What is life expectancy anyway? Life expectancy is an overall measure, a summary measure of population health. And what's important about it is that it's one number that actually allows us to compare health status potentially over populations, or over different groups, or over time. And so all this graph is telling you is that the US in the red has a life expectancy from 2015 of a little over 78 years. But all those other countries from the OECD to the right of us have higher life expectancies than we do. Another feature that you'll be seeing throughout this talk and in some of the other talks is that there's actually a gap in average life expectancy at birth between women and men. Women in all of these countries have higher life expectancies than do men. So let's talk a little bit about what life expectancy is and what can impact it. Average life expectancy at birth it's actually a little bit of a modeling exercise. Imagine, if you will, a baby born today. And then imagine that the death rates that exist today stay constant throughout that child's entire life. What is the age at which we expect that newborn to live if those death rates are held constant? So one way that I can maybe give you a little bit more of a feel for this is in 1900 in the US, life expectancy at birth was 47.3 years. Now, what happened in the first 50 years of the 20th century? We had improvements in sanitation and hygiene and the introduction of antibiotics and the implementation of vaccination programs. And 50 years later, the life expectancy at birth had increased by about 20 years. So in 1950, a newborn born in that year would be expected to live to be 68.2 years old. So life expectancy at birth is one kind of summary measure of health statistics, and age-adjusted death rates are another kind of measure that is a summary of the health status of the nation. And they have a little bit of an inverse relationship. You can see that as those age-adjusted death rates come down, the life expectancy is going up. But what is age-adjusted death rates? Why can't we just use death rates? Why can't we just take the number of deaths over the total number of the population? Wouldn't that be a more fair comparison? Well, the same way that life expectancy is that summary measure that allows you to compare across populations or compare over time, age-adjusted death rates do the same thing. And so for one example, we can show the population pyramids from 1975 and 2015. We, again, don't need to get into the details, but what you can see is back in 1975, we had a much younger population. For the most part, there were many more people who were between the ages of, let's say, 10 and 30, and fewer people who were over age 65. Whereas by the time we hit 2015, that proportion that was older had actually increased quite a bit. And so if we just compared the death rates from 1975 to 2015, all we're doing is comparing rates that say, well, we've got an older population in 2015. So what do we do when we are adjusting for age? We actually take a standard population, right? So many of the standard populations in our report use the US Census from 2010. And we will take the population from 2010, and we will take the death rates from, let's say that was 1975, and apply them to a 2010 population. We'll take the death rates from 2015 and apply them to a 2010 population. We remove the effective age of the age structure of the population so that we can make real comparisons between those two groups, between those two times, and actually have an understanding of what the health status of the nation is. Now, you may have picked up a report in your time here where you've gotten an age-adjusted rate for 2017, but it looks different from an age-adjusted rate for 2017 that you've seen elsewhere. Why on earth are those numbers different? Don't panic, just read the footnotes, because there's actually a very good chance that that someone was using a different standard population. And so as long as you're using the same standard population, those estimates will be similar. But now that I've given you a little bit of an understanding of where these numbers are coming from, let's look at the numbers that the Congressman was just talking about. So life expectancy at birth has been decreasing since 2014. And you can see in this graph the same thing that we were seeing in the OECD figure that compared across other countries. Women generally tend to have a longer life expectancy than do men. And one of the things that we've been hearing about in the news is that since 2014, those life expectancy estimates have in fact been coming down. Now for women, there was only one significant decrease between 2014 and 2015, and those rates have held constant still since then. And for men, those rates have decreased each year since 2014. If we break it down by race and ethnicity, we see a very similar pattern. For men, Hispanic men have the longest life expectancy, but we're still seeing those decreases each year. Same for non-Hispanic white men and non-Hispanic black men. And for women, we have that same sort of pattern where we were seeing an initial decrease between 2014 and 2015, whereas those decreases have leveled off among each of those racial and Hispanic origin groups. But again, remembering what we said about life expectancy, that life expectancy at birth tends to increase when we have big changes, or actually even small changes, among our youngest age groups. So one of the things that we did to explore these decreases in life expectancy is look at the changes in death rates for all causes, just thinking about deaths for everything. And what we found was actually significant increases during that time for age groups we weren't expecting, 15 to 24-year-olds and 25 to 44-year-olds. And if we break those down a little bit more, we start to get into understanding the statistics that we have seen in the news and in other reports. When we look at the leading causes of death for men in this youngest age group, thinking about what has actually been on the increase, we see significant increases in homicide, suicide, and unintentional injuries. Now, unintentional injuries can sound just like accidents or motor vehicle accidents, but also includes those accidental drug overdoses. So obviously that's something that everyone's concerned about. We see a similar pattern for young men aged 25 to 44. Homicide, suicide, and unintentional injuries have some fairly steep increases, as well as another cause, chronic liver disease and cirrhosis, which is a chronic, can be have a risk factor of chronic alcohol use. We see similar patterns for women, although I will note that the scale's a little bit lower here. So we are still seeing among women in these younger age groups increases in homicide, suicide, and unintentional injuries, and again, the same pattern for women in the age group of 25 to 44-year-olds, where we start to see an increase in chronic liver disease and cirrhosis. And of course, if we want to even more go into the increases in unintentional injuries, we can also focus on drug overdose rates. This is actually something that's in the report that you have in your hands. The drug overdose death rates for men age 15 and over, what we found was that these drug overdose death rates were increasing and increasing fairly steeply for again, the younger men, age 15 to 24, 25 to 34, and 35 to 44. But I will note that this occurred in all age groups. And we saw the same patterns among younger women, and again, increases among all women. I don't want to leave you thinking that the only influence in the decreases in life expectancy were unintentional injuries and suicide. I will also call your attention to heart disease and cancer still being the leading causes of death in the US. And while heart disease deaths have been on a general decline, those declines have actually stalled out since about 2011. So again, my main takeaways today are life expectancy has decreased in recent years among men and women, although there are differences by sex and race and Hispanic origin, and that those decreases have really been driven by changes recently in age-specific death rates. Thanks.